Acid reflux, which occurs in almost every person, adversely affects the quality of life and health. Acid reflux is also commonly known as heartburn, and in this video today we will discuss the complex issues of acid reflux. If you suffer from acid reflux, understanding the causes, symptoms, and treatments of this disease is very important for a better quality of life and a healthy body. Dear viewers, I would like to go straight to the information about acid reflux without making the video introduction too long. What is acid reflux? Acid reflux, also known as Gastroesophageal Reflux Disease, is a common digestive disorder that occurs when stomach acid backs up into the esophagus. Stomach acid is a very strong acid, because the digestion of food in the stomach begins with stomach acid. Normally, there is a lower esophageal sphincter less, a ring surrounded by a muscular structure that acts as a barrier between the esophagus and the stomach. When this structure is weakened or improperly relaxed, it cannot act as a barrier against stomach acid. As a result, stomach acid leaks up into the esophagus. The stomach acid irritates the delicate lining of the esophagus, causing a number of unpleasant symptoms. What causes acid reflux? The occurrence and development of acid reflux depends on several factors. I would like to explain them briefly. 1. Diet. We can say that the main cause of acid reflux is the food we eat. Spicy foods, high-fat foods, citrus fruits, coffee and carbonated drinks disrupt the mechanism of gastric acid production and trigger acid reflux by relaxing the lower esophageal sphincter. 2. Lifestyle habits. Smoking, excessive alcohol consumption, and obesity put pressure on the abdomen and weaken the lower esophageal sphincter. Sleeping or lying down after meals can also cause acid reflux. 3. Medical conditions. When the esophagus is short or the diaphragmatic cavity is enlarged, the stomach, which should be in the abdomen, slips up into the chest cavity. This is called a hiatal hernia. This disrupts the function of the les and causes acid reflux. 4. Pregnancy. Pregnancy causes biological and hormonal changes in a person. These hormonal changes in pregnant women and increased abdominal pressure due to the swelling of the abdomen caused by the baby can lead to acid reflux symptoms. What are the symptoms of heartburn? Acid reflux varies in severity and frequency from person to person. Acid reflux can manifest itself with various symptoms that may vary between individuals. However, in general, there are common symptoms that are shared by all individuals. I will now explain what these are one by one. 1. Heartburn. Heartburn is characterized by a burning sensation in the chest area after meals or while lying down. 2. Regurgitation. Regurgitation, medically defined as the regurgitation of food, is a condition that occurs when stomach contents come into the mouth. It usually occurs after meals, but sometimes during meals. It causes a burning sensation in the throat and a bad taste in the mouth. It is a common symptom of gastroesophageal reflux. 3. Chest pain. Patients may think they are having a heart attack because they have chest pain during a reflux episode. This is not a heart attack. It is caused by pressure, burning, and squeezing in the chest from the refluxing stomach contents. Mid-back pain or chest pain are also symptoms of reflux. 4. Difficulty swallowing. This condition, known as dysphagia, is an indication of damage to the esophagus irritated by stomach acid. Patients feel like food is stuck in their throat or chest and have difficulty swallowing. 5. Chronic cough. A persistent cough, especially at night, may be a sign of reflux. It can affect the throat and airways, causing a chronic cough. In the community, at least 25 to 40% of chronic cough cases may be related to reflux disease. How is acid reflux diagnosed? The diagnosis of acid reflux involves a thorough evaluation of symptoms by a healthcare professional. The doctor can diagnose acid reflux by performing several tests. What are these tests? 1. Endoscopy. This is a procedure that uses a flexible tube and a camera to look inside the esophagus and stomach. Endoscopy is a procedure that can detect inflammation, ulcers, sores, or other abnormalities. 2. Esophageal pH monitoring. a test used to assess the frequency and severity of acid reflux attacks. This test diagnoses reflux by measuring acid levels in the esophagus over a period of time. 3. Esophageal Manometry. Esophageal manometry is a special test that evaluates the strength, regularity, and function of the contractions of the esophageal muscles during swallowing using a special catheter inserted into the esophagus. What are acid reflux treatments? Acid reflux prevention starts with lifestyle changes. In general, there are 3 types of acid reflux treatment strategies. 1. Lifestyle changes. This is one of the most important treatment strategies. Lifestyle considerations such as avoiding trigger foods, not overeating, and not lying down after a meal help reduce acid reflux symptoms. Also, maintaining a healthy weight, elevating the head of the bed, and avoiding smoking and alcohol should not be forgotten. 2. Medication. Over-the-counter antacids provide temporary relief by neutralizing stomach acid. H2 receptor antagonists such as ranitidine and proton pump inhibitors such as omeprazole help reduce acid production and relieve symptoms. However, it is important to remember that these medications should only be prescribed and recommended by your doctor. 3. Surgical intervention. Some acid reflux conditions can become serious. In severe cases that are refractory to conservative measures, surgical procedures such as fundoplication or placement of a Lynx device are performed to strengthen the LES and prevent acid reflux. Dear Healthy Living viewers, acid reflux is a digestive disorder with many different causes and symptoms. Individuals can effectively alleviate symptoms by becoming thoroughly educated about this condition and using appropriate treatment strategies. Remember that acid reflux condition seriously affects the quality of life. Therefore, if you are experiencing persistent acid reflux symptoms, I strongly recommend that you consult a specialist for proper evaluation and personalized treatment recommendations. Thank you for joining us on the Healthy Living channel. If you like our video, please don't forget to subscribe, comment, and like. Bye-bye.